Have you ever heard about hemolytic anemia? It's a blood disorder where your body's red blood cells are destroyed faster than they can be produced. Imagine a factory unable to keep up with demand. That's what's happening in your body. The result? A shortage of red blood cells available to deliver oxygen, which can lead to fatigue, among other symptoms. This condition can be something you're born with, or something you acquire later in life. Now, you might ask, what causes hemolytic anemia? Hemolytic anemia can be caused by a variety of factors. Delving into the causes, we find a multitude of potential culprits. Inherited conditions can play a significant role. For example, sickle cell anemia or thalassemia, where abnormal hemoglobin leads to the premature destruction of red blood cells. Immune disorders also come into the picture. Sometimes our immune system mistakenly identifies our own red blood cells as foreign invaders and destroys them. Infections, too, can contribute to hemolytic anemia. Certain bacteria or viruses can lead to an increase in red blood cell destruction. In addition, certain medications can have side effects causing hemolytic anemia. Blood cancers, such as leukemia or lymphoma, can also lead to this condition. And then, there are times when the cause remains unknown. This is referred to as idiopathic hemolytic anemia, which can be a bit of a medical mystery. Knowing the cause is crucial, but how can one identify if they have hemolytic anemia? Let's explore the symptoms. The symptoms of hemolytic anemia can vary, but there are some common signs. Fatigue often sets in as your body isn't getting the oxygen it needs. You may feel weak and experience shortness of breath even after minor activities. Dizziness can occur as the brain is starved of oxygen. Visibly, your skin might appear pale or take on a yellowish hue, a condition known as jaundice. This is due to the excess bilirubin produced when red blood cells are destroyed. Rapid or irregular heartbeat, known medically as tachycardia, may also be a telltale sign as your heart tries to compensate for the lack of oxygen. If you or someone you know is experiencing these symptoms, it's important to consult a healthcare provider, but what can they do about it? Treatment for hemolytic anemia is as varied as its causes. The first line of attack is often addressing the underlying cause. For instance, if a medication you're taking is triggering the condition, your doctor may switch you to a different drug. In cases where the body's own immune system is destroying red blood cells, steroid medications or immune suppressants are often prescribed. Blood transfusions can be a lifeline for those with severe or sudden onset hemolytic anemia, providing an immediate boost of healthy red blood cells. For some, a splenectomy or removal of the spleen may be recommended. This is because the spleen is often the site where red blood cells are destroyed. Remember, early detection and proper treatment can significantly improve the quality of life for those with hemolytic anemia. So, what have we learned today? Hemolytic anemia is a condition where your red blood cells are destroyed faster than they can be replaced. It can be caused by a variety of factors, including inherited conditions, immune disorders, or infections. The symptoms can range from fatigue to jaundice, and the treatment can vary based on the underlying cause. This could include medication, blood transfusions, or even surgery. Thank you for joining us in this exploration of hemolytic anemia. Remember, knowledge is the key to staying healthy.